All right. Good afternoon, everyone. Thank you for being here. Our daily briefing. Let's get right into it. We have more testing back today from yesterday. Yesterday, we ended the day with 34 positive cases. Today, we are at 45 positive cases. There's 39 specific cases, 6 are contacts with some of the 39 specific cases. That's where we get to our 45. So the 6 cases are not a surprise. These are individuals that were in a quarantine situation that went through testing. Again, we anticipate higher percentages of folks who are in quarantines to then test positive overall. Related to the amount, let's break down where the tests are coming from. We have a new chart here, which is going to go live on our website. 13 of the cases are from the city of Syracuse, 7 from the town of Salina, 6 from the town of Clay, 4 from the town of Cicero, 3 from the town of Manlius, 3 from the town of Onondaga, 2 from the town of Lysander, 2 from the town of Pompey, and 2 from the town of Skaneateles. We have a situation where we have a community spread. There's not one part of our community that's immune to this. That's why it's so critical that social distancing is followed and the policies that are being put in place, everybody in the community does their part. Ages, we have, let's see here, 13 cases of 29 and below, 6 in their 30s, 7 in their 40s, 6 in their 50s, 5 in their 60s, 7 in their 70s, 1 in their 80s. We have 25 females and 20 males. We have 120 plus people that are currently in mandatory isolation and quarantine. This is a moving target when we're looking at individuals that may be coming out of a quarantine now and looking at individuals that certainly, as our investigations mature and some of these each day, more and more people may be into a quarantine. Look, what does the data mean? Our goal was to test as many people who are sick and symptomatic with any flu-like symptoms as fast as we can. Right now we have over 900 tests back, so our percentages are in between 4 and 5% of the tests outstanding are coming back positive, and we expect to get a similar number of tests back in the next 3 to 4 business days as well. So our number will go up, and that's what we need to do. We need to figure out as a community who is sick. We need to get these people help. We need to get these people into mandatory isolation. We need to get people who have had direct contact with them into quarantine. That's how we bend the curve. So this is something we knew would happen, and right now we're very lucky that we've been able to do the robust testing that we have. Certainly when it comes to testing, we get lots of questions about this. All positive tests are reported from the State Department of Health to Dr. Gupta and her team. The negative tests are coming in from various parts of the medical community. Some are being done at hospitals. Some are being done at our testing triage site. Some are being done at primary care providers. Each primary care provider has a different contract with a different lab that's doing testing. Each hospital is using a different lab that's doing testing. So the negative tests, the turn times essentially on average have been 3 to 5 days. Right now, these labs aren't just doing testing for Onondaga County or upstate New York. They're doing them for communities across the country. So we would love the testing turn times to be back faster so that we could get the positive results back faster. And that's why we did our executive order, making it a misdemeanor if you get a test and then you don't abide by the mandatory quarantine during that time period, you're breaking the law. So we didn't want people who got tested to be out in the public doing things. That's why we did that, is because we knew there was going to be a lag in the testing time because there are thousands and thousands of tests being done every day now. So again, I know some of the news outlets specifically, the best we can give you right now is it's a 3 to 5 day turn time. That's what we're seeing. Sometimes some of the testing sites are moving a little faster, and the second we get them, we talk about them. Okay? The Upstate Triage Hotline, we've received over 5,100 calls for assistance. The additional tool we talked about yesterday with Upstate and Microsoft with the new algorithm, part of our digital alliance. This data is amazing. The coronavirus assessment tool on upstate.edu's main page has seen over 17,000 clicks onto that tool. It's been up for a little over a day. So that's a great algorithm to go there, get more information so you can assess what your next steps are if you're feeling sick, certainly. Talking about mandatory isolation and quarantine a little bit here more. When somebody gets tested positive, there is a court order that they are in mandatory isolation. And these people are sick. These people have done nothing wrong, but part of their responsibility to the community is to make sure they abide by the law. And I want to talk about the human side of this too. I received an email earlier today from somebody who tested positive. I'm not going to give their name, but it's somebody I know. They're doing well. They traveled abroad. They came back. They tested positive. And he told me he was very comforted that our health department has been reaching out to him twice a day, just checking in on how he is. But certainly there's going to be more positive tests in the next few days. The percentages have been pretty consistent. This is kind of what we anticipated. And the more people we can test now is going to help us bend the curve because we get to get them treatment. Part of our updates are going to soon be not just who is sick, whether they're hospitalized or not, what their ages are, where they live, but who is recovered, because that's part of this process as well. We have 4 out of our 45 neighbors are in the hospital. 1 is in critical condition. 3 others are in the hospital going through their routine process. Social distancing with young people. We talked about this yesterday. We need everybody to be smart, and we need our young people coming back from spring break, other parts of the world, of the country, to self-quarantine for a period of time. We're asking you to do this. We're trying to understand how many people this is coming back in. I've gotten emails saying, look, if there's healthcare workers that went on spring break. A lot of people like going on vacation this time of year. And I have a vacation coming up on April 4th. Guess what? It got canceled. Okay, so a lot of people need to realize the safest place for you now is at home, and that's really important. And if you're coming back from a part of the country, and just if you're traveling overall, it's probably smart that you quarantine yourself for a period of time to see if you become symptomatic. And we're asking you to do this now. Certainly, we will utilize any tools we have if we think we have a problem moving forward. Also, our snowbirds coming back from Florida in the spring. We encourage you, especially our seniors, you should be home anyways, but we encourage you to self-quarantine as well to really stop the spread and let's starve this virus. Certainly, our non-medical task force, we are very concerned and we'll continue to talk about this on a daily basis. Our social and emotional health, our mental health is certainly being challenged as each day goes by. If you're in a position where you need to talk to somebody, you need to get some help, please contact 211 for immediate concerns. Our senior first responder and adult nutrition line, 218-1987. Please contact that for any reason. I had someone email me today talking about that they're seniors, they babysit for their grandchildren, and their kids are deemed for essential businesses, so they have to go to work. We want you to contact us if that's the case. You shouldn't be watching your grandkids. We'll help you with childcare. We have over 1,900 slots available now, and let's just be smart. Let's get this done. We'll worry about how it gets paid. Right now, we're doing these childcare slots for our emergency personnel, our healthcare professionals, and we can even expand that to essential businesses that are in these types of situations where we'll pay for the daycare slots. We've set this up. We have a plan. We have over 1,900 slots available. We don't need grandma and grandpa being daycare for essential businesses at this point. We need grandma and grandpa being healthy, and that we know that they have been, because I'm going to reiterate some of the data in a little bit here. But certainly any individuals in a daycare situation where a daycare bind, please contact Child Care Solutions, 315-446-1220. I want to emphasize some of the data on on our positives. Over 58% of the individuals are under 50. 40% of the individuals are under 40. Only 18% are over 70. The stereotype has been this is about our seniors, and our seniors are certainly most vulnerable to getting sick in a way that becomes very serious. But everybody under 40% of our cases are under 40, you got it. And these percentages are going to hold up. And so how do we get that trend going down? We social distance. We're smarter. We take this seriously now. And I think that's something that certainly everybody under 40 needs to step up and really get that done. So saying that, I want to thank Senator Schumer, Congressman Katko, for their support in these stimulus packages that we see. One of the first stimulus packages, the economic stimulus with additional Medicaid funds, would bring an increase in Medicaid funding to the county. That is critical. We are going to be in some serious economic times when this is all done. And I'm getting other questions related to the economy. My job, I was making X and X amount of money. I'm in this industry. What are you going to do for me? Well, government cannot solve everybody's problems. But what we can do together is, if we want to see a quicker and stronger economic recovery, we social distance. We're smart. We realize we're going to have pain for the next 2, 4, 5, 6 weeks. But then after that, you can go try to make your commission back, because you're going to have people you can call on, because we're going to starve this thing. The longer people in our community don't take this seriously, the longer we're going to be in a situation where we only have essential businesses reporting to work, and that our healthcare infrastructure is going to be working around the clock trying to quarantine and identify sick patients. So our message is for us to get back and really focus in on an economic recovery, not the public health side of this right now. We need everybody to take this seriously, and take this seriously with your children, not letting your children play with friends, really implementing social distancing protocols. Our essential businesses, we're getting a lot of concern and a lot of anxiety about the employees still going to work. Certainly, we want you to implement good social distancing practices as well, even though you are deemed essential. We need you. We need you to continue to do what you do. But let's certainly, if there's your employees aren't showing up because they start getting sick, it's going to be hard for you to keep your business running. So let's be smart with that as well. And also, certainly, as we hear more and more about looking at repatriating some of our manufacturing on the pharmaceutical side of things, and we're looking at testing, I want to remind everyone that our Bristol-Myers campus is underutilized and is an excellent facility, whether it's for contract manufacturing, but for the state and federal government, there's probably not a better facility available to turn over quickly than that facility. That can expand quickly for production, and certainly for the governor and the president and all of our partners. I want them to think about that because it's right here in Onondaga County. Questions for myself or Dr. Gupta?
Localities again. I either missed one. I just want you to run through the
Sure.
localities and the numbers again. I know they're listed near you.
Yep. 45 total. 13 Syracuse, 7 Salina, 6 Clay, 4 Cicero, 3 Camillus, 3 Manlius, 3 Onondaga, 2 Lysander, 2 Pompey, 2 Skaneateles. And this right here, Andrew, that will be on our website, being updated on a daily basis.
Those 11 cases that were from yesterday, or that you got today, when were those people tested?
It's safe to say within 3 to 5 days. We're getting them in real time, and it doesn't tell you when you get the information in, the day they were tested. That happens through the investigation, but everything is on a 3 to 5 day lag time. So it's the answer can be, if today is the 22nd or 21st, the longest period of time, 5 days ago. So the 17th, the shortest period of time, 3 days ago.
And where are you guys getting the 3 to 5 day test from? And have you guys looked at other facilities that can maybe do the tests quicker?
Right now, nobody's doing it quicker. So you're looking at, you have different, your primary care providers have different contracts with different facilities. Quest has been the major testing partner down at the Syracuse Community Health Center. The Upstate goes to the lab in Albany, and Cross has their own partner, and St. Joe's has their own partner. And so they all have their own partners. They do testing. Whatever the turn times are for those companies, that's what the turn times are. So for us, we're the clearinghouse. We're the government. We get the information coming in. We can't mandate any turn times. And mind you, as this becomes, these people aren't just doing testing in Onondaga County. They're doing them in Long Island. They're doing them in New York City. They're doing them in Washington, California, et cetera, et cetera. So when we're looking at when we're getting it, we know that the testing was done 3 to 5 days in almost all cases. Every once in a while we'll get one faster, and I haven't heard of anyone going longer than that, but I'm not saying that hasn't happened. But that's where we are.
What's the process to inform a patient of their positive results?
I'll let Dr. Gupta talk about that.
So when there is a test positive, we get, if most of it can come through the New York State Department of Health, that's the electronic reporting surveillance system. And also the physicians are calling us, which is fantastic. The hospital's infection control are calling us. There's a lot of communication is occurring because everybody wants to make sure that we have that information. So I would rather have them call us, even though we have that, we continue to do that. So when we have that positive case, our first preference, if person has a primary care provider, we are asking them to call your patient and inform them, because it could be a little bit of a nerve-wracking for the patient to feel like, oh my God, what happened? Even though 80% of people do fine, I think emotionally they can be charged. So first is that warm handoff from there, that now County Health Department is going to call you, and then we actually follow up. What we are also asking our either hospital doctors or the primary care doctors, making sure that you start to have the conversation. Because you had the test, you were already in quarantine. Now you will be firmly in quarantine, what we call isolation, and then County Health Department is going to have further instructions for you. So at the same time when these things are happening, we continue to educate our primary care provider, because they all are learning in this process, that what is and we have to also ask multiple questions. What are their contacts, where they traveled, what kind of work they do, what kind of exposure they may have from somebody else, or they might have exposed other people. So all these things, questions we go through. And temperature checks, we make sure they have the right place, like, separate bedroom, separate bathroom. Do they have any needs? And most of the people we have is that they may have small needs like thermometer. Some people might need some other needs. Somebody may have they need some prescription that need to be delivered. So a lot of those things on case-by-case basis, and we continue to call them in daily checks. And if they have anything changes in their condition, they are supposed to call 911 if that's the acute one. Otherwise, we can coordinate things with them.
And they find out just about as quickly as you guys find out?
Yes.
And you actually almost answered my next question, but I'd like you to add a little to it. What does the work look like in your office in terms of staying in contact with either the positive cases or the quarantines connected to their contacts?
Right. So we have a daily calls to them. They all know they're not going to go anywhere. They are going to stay in the house. They can go outside of their own, like in a backyard or on a front porch, but not anything else. They are not supposed to go grocery shopping and mingle with anybody. Nobody can come to their house either. So use all those electronic devices. You can have Google Hangout or Skype or anything which you want to do. So they are following that, and we are following them with the phone calls. And they have the information to call us also. So like we are on call, so we get to the answering service those after hours when there's nobody in the office.
And are their needs being met either by family members staying outside at the door or through your teams or combination?
Right. So when we do is that when they are, let's say someone says that we don't have our grocery, we ran out of that. So what we will do is that ask their list and then put things together and put things and deliver to their door and inform them from the phone, delivered, pick it up now. So nobody should be taking it, but we just want to make sure they picked it up. The same thing if their family and friends are doing it, we certainly don't want them to be exposed, and that's exactly instructions. They are doing it also.
Can you tell us anything about any commonality, either a location or a person, that can explain a few of the cases, half a dozen cases?
So there's 39 individual cases. 6 of the positives out of the 45 are related to those. So
To the quarantines?
Yeah, so we have 45 total. 39, we would look at them as 39 separate cases. Okay. 6 of the quarantine individuals have now tested positive related to various members there.
Right, so among the 39, is there anything that even links 2 of those cases, or 3 or 4, any commonality?
And Dr. Gupta, if I'm wrong, interrupt me, I don't believe we have seen a case where this one was because they contacted this one at work, et cetera, et cetera. This is, you have traveling and you have community spread. The links between the 39 and the 6 at this point are really, we've identified you should be in a quarantine. They end up getting tested. They end up testing positive.
Right.
So they're...
Does the county have a specific number of ventilators that you guys have an inventory of for people in the county?
Yeah, county, we're in the process through emergency planning and our emergency management team to look at setting up a potential emergency triage ICU site. We'll talk about that when all the details have been finalized. But the county government, traditionally, we don't buy ICU, ventilators. We've never really needed them before. The hospitals have ventilators. There are certain medical practices that have ventilators. We've been taking an inventory on those, and certainly we take a daily inventory with our hospital on what the emergency room capacity looks like, what the ICU capacity looks like, what kind of shape are we in. It's been a good 2 or 3 days for us related to that with our hospitals. There's a lot of capacity right now because of essentially the way that our triage site is taking that pressure off the emergency rooms. So, but we are certainly, just like all of our emergency supplies now, we're looking to procure things that we've never thought about procuring before.
So you're saying that the hospitals have these tools, but the county does not have any. Are you guys looking at getting some as urgently as possible? And if you are, what's the time frame of getting those?
Yeah, look at if these things were widely available, you wouldn't hear the president talking about manufacturing them, the governor manufacturing them at all. These are not widely available. They need to be manufactured. Our procurement teams are looking at some of those. We don't have a ventilator issue in Onondaga County right now. It's something that we would need to see a very, very, very large community spread for that to become an issue. But that's something that we've already begun planning for.
Our local viewers see the governor every day, and this is something you and I talked about, but I think it's important for them to hear. The differences between the statewide picture and what it looks like in Onondaga County.
Yeah, the governor has a very diverse state that he's working on right now. And because of our response and the fact that we have the robust medical infrastructure that we have here. Our issues are in a position where we're kind of still ahead of the curve right now. The governor is dealing with situations where he's got millions of people downstate that the situation is not as fluid. And so when the governor's talking about many of the issues he's dealing with, he's talking about that in context to the communities that have a wide community spread. New York City, Nassau County, Suffolk County, Westchester, Rockland County, Orange County. These are all communities that have a wide community spread right now, and they're running out of that medical infrastructure. And they have a lot more people still there. So that's what much of the governor's conversations are specific to those challenges. Here, what we've been able to do is we've been able to learn from all these other communities and see how things have progressed. At the same time, we're learning on what countries have done well and what they did to help bend their curves. And we're implementing those practices, and we're planning for the worst case scenarios. So ventilator shortages, that's a problem right now south of the Hudson. That's not a problem here right now. We're knocking on wood. We're going to try to get ahead of it and set up alternative sites in the event we had a surge and needed a surge site. So that's something that we have the benefit of time being on our side right now, and the benefit of having a triage testing site up and running before we even had a case of COVID-19. We were doing tested before we had COVID-19. So we've always been a step or two ahead of the curve because we were seeing what was happening in hot spots around the country, and we implemented best practices right away.
We're hearing the governor talk about using the Defense Protection Act. Do you have a stance on using that as well?
Well, I think the president has to use the Defense Protection Act, but the governor encouraged that. And I think absolutely it's a good idea. I think when at the end of this process, I think you don't need to be of a certain political persuasion to think that's probably a good idea. We don't have all of our healthcare manufacturing and pharmaceutical manufacturing in China. It's just probably a good idea that we repatriate that type of manufacturing moving forward. And I don't think there's going to be a certain political persuasion of thought with that. I think everybody should think that's a good idea.
When you guys get the tests back between 3 and 5 days, if you get them on day 3, are you reporting them on day 3? If you get them on day 4, you're reporting them
We're literally, and again, I've gotten this question a couple times. I don't know if it's from your outfit or not, but we are literally reporting them minutes as we get them. Sometimes we don't even know who these people are. We just know we got a test result, boom, come on over. Yesterday, I didn't even know who I couldn't tell you 3 of the people, if they were male or female or how old they were. I was just told we have 3 more positives. You got the number. So the number, we've been doing these briefings during the week at noon and at 3 because the information is changing so fast, and we're getting it out to the public. On weekends, it's just been more effective that we do this once at 3 o'clock. We got, we have a better handle on that, because there's so many people working on the weekends.
Today at 8 p.m., the pause order goes into effect and Matilda's law. I just wonder if you could tell the public what they should expect to see, how things are going to be different, if at all, before 8 p.m. and after 8 p.m. today.
Yeah, I think, look, we have a new level of distancing that's going in right now. People should take that seriously, and certainly we're going to be monitoring it to make sure people are. We believe in what is trying to be accomplished, and we believe that that's how some of the strategies that will be effective in bending the curve. And so people got to take it seriously. I mean, we really want you home. If you need to go to the grocery store, you need to pick up some things, that's fine. But if you're a senior, we really want you home, and if you really need something, can you ask a loved one to go out and do that for you? If not, call our senior line. We'll help you. Certainly, if you're in any sort of quarantine situation, you are not to be going out. And if you need help, you call our line. We're going to help you. You're our neighbor. We're not leaving anybody behind in this process. Everybody's going to get what they need. But certainly, the traffic, even the traffic we've seen over the weekend, will be thinned out. And I think everybody needs to take this time and just realize that we are in uncharted waters here related to a virus, that the only real impact we can have right now is we have to starve it. And how do we starve it? We have to do something very unnatural for people. We have to kind of stay away from each other, and we got to hunker down with our loved ones. And that's our best way to get in front of this.
Yesterday, after I left you, driving away, I saw a bunch of kids playing basketball at one of the city basketball courts. The governor literally said basketball is an activity that's too close to be effectively socially distanced. Are you prepared to go out with cars to monitor, and are you fearing some people just aren't taking this seriously yet?
Yeah, some people aren't, and we're going to have to look at those situations. I got some complaints about corner stores today, that you get people congregating outside corner stores. We're going to get those. You know, we might send over some law enforcement to break those things up. Looking for the kids who are playing hoops against each other. NBA players got it, right, from each other. They're playing basketball. You know, games happen. Players on each team ended up getting positive. So you can spread it by boxing out and posting up and playing tight one-on-one defense, okay? So that's something that is proven. So these kids should be smart. You're not invincible. The data shows that under 40% of the people under 40 in our community, out of our positive cases, are under 40, right? And let's see, 10 of them are in their 20s, okay? So our 20-year-olds aren't invincible. So I think when we look at this, let's take it seriously. If we all take it seriously, the impact and the time we can get back to normal will be faster. And that will be better for all of for the economy overall, for everybody's personal economic situation. It will get better. That's going to get scary for people soon. I think the federal government is going to come in with various stimulus packages, which will be helpful, but that will just minimize the pain. There will still be pain. The quickest way for us to get back and focusing on an economic recovery is to get the curve going in the right direction. And right now, we are testing our testing numbers related to people asking for the test, not test themselves, but continue to start to trickle downwards. We're now looking at 4 of the last 5 days are trickling downwards. We're seeing that across the board. To us, that means maybe we're getting the test to all the people who are sick. That's what we hope that means. But that's part of the process. But all that good work, we can get in front of it, and then we can see it pop right back up. If people are coming into town, they're not self-quarantining, or they're not listening to social distancing rules, and they're going out and just hanging out with their buddies and not taking this seriously.
Ryan, your favorite question. What's the good news today?
Yeah, good news. Well, look at we have more data that we've been sharing so that people understand that this is real and they need to take this seriously. This isn't just a problem in one municipality, it's spread out, okay? We're going to continue to see that. But I think the fact is, as we continue to tell the story and talk about what's necessary for us to get to the next step of this mitigation process, the community seems to be responding. And I think that's going to be the good news each and every day, are the human stories, Andrew, about how the community is responding to this. And right now, the community continues to respond well. They continue to reach out to us in ways they can help. They continue to volunteer, and we continue to have the best professionals in our county government, and our health department, and our emergency management team.
With the 4 hospitalizations, one person's in critical condition,
Yeah.
and what specifically are the conditions of the other 3?
How would you phrase that, doctor?
They're what we call they're stable. They are pretty much recovering quite well.
Okay, but are they in critical condition? Or
What's that?
Being stable doesn't mean...
Well, stable means they will be ready to discharge soon. So they continue to recover. They are in a right trajectory. I think that probably clarifies that. Because when people get hospitalized for pneumonia or anything which might have led to their hospitalization because of the COVID-19, then that means that the patient continues to improve, the fever gets down, then the breathing gets better. It means they're eating and then ready to be discharged. So that's the right trajectory. So when we say stable, I know it becomes a medical term. It's so hard to get my head out of that medical term. So your question is good, but it means that they are in the right trajectory to be discharged.
So
soon, but I don't know how soon.
I'm sorry. And the hospital association has like fair and good. Can any of those other three be fit into one of those hospital classifications, fair, good, and one is?
I mean, I would say good. Yeah.
And just to touch on most of these individuals, it's safe to say in the next 14 days, are going to transition to where they're getting tested again, and if they get a negative, they're better. Okay, and so I think that's part of this process is we'll continue to report the positives, and we're going to report the negatives, and we're going to continue to give as much information that we can without breaking any HIPAA laws, and we're going to talk about in any point of any of our investigations into these individuals' cases, if we can't put the puzzle pieces together and we need the help from the public, we're going to put out press releases asking for the public's help. But I think it's important to remember from the public, most people get better. And that's what we need to focus in on with our neighbors here is we need to get these people better, and most of them will get better. And so that's kind of what we need to think about and pray about. These are our neighbors. And again, I've said this before, but every one of us is going to know somebody at some point that is in a quarantine or hear of somebody that tested positive. And they should not be treated differently. They are our neighbors, and they have done nothing wrong.
With the positive number of cases coming back from younger generations, has the county looked at what professions these people are coming from? Are they coming from these essential businesses?
Yeah, I think the investigations go on. There's no rhyme or reason to this. These aren't a lot of numbers. If you look at it, we have 470,000 people, right? From a percentage of the population, this doesn't even show up on a chart. But certainly some of this is travel related, and some of this is community spread. So, I think it's, whether it's business travel, whether it's personal travel, a lot of it's travel related, and a lot of it's community spread. It's here. So now we got to starve the thing out.
Can you tell us how many ventilators exist in the county and how many we need? How many ICU beds exist in the county and how many we need?
Yeah, we can send us a written email requesting that. We'll have to go and do an inventory of all the hospitals, all the various orthopedic surgeons, everything else. They all kind of have the equipment. But again, this isn't something that we don't own a nursing home, right? We don't own a hospital like other governments. Until now, we never thought we would be in the business of looking to procure ventilators. Now we're in that business because we have to prepare for the worst.
You don't want anybody in the hospital, but with that current number, I would assume it's safe to say the hospital capacity can handle what's there, and then there's room on top of that. Yeah,
we have our infectious and disease control experts, and Dr. Thomas is one that has spent a lot of time with your news outfit, Andrew. They're ready. They're ready. The decision making that we have all made to this point on policies to do this, to do that, to open this, to spend money, was to prepare for this day when we have the potential need for these ICU units to help very sick people. And they're ready. They have capacity. What we're in the process of, we're planning for the next step. And then in 3 weeks from now, there might be a next step after that we got to start looking at planning for. And we'll continue to do that. But certainly with the coordination and the robust medical infrastructure that we have here, we are in as good a shape as you can be to treat our sick and stay in front of this curve. The fact that we still have testing that is being done is better than most communities right now. And we continue to work extremely hard on our supply chain every day, and we continue to have some success there. So right now we are where we really need to be. These numbers are going to get higher. Okay, we got essentially another 900 to 1,000 outstanding tests. So we're going to see similar numbers come back positive with all that. We need that. We need to identify these people. We need to get them help, and we need to quarantine everybody so that we can get the curve going downwards. So we're very excited to get these test results back. I wish it could happen sooner, but there's a lot of competition in this new marketplace right now. One more question. We good? All right, thanks, folks.